I want to introduce everybody to Dr. Weisberger. Hi, Michael. How are you?
Good. How are you doing?
Today I want to talk about thumb arthritis because, I mean, people seem to be coming down with a couple cases of thumb arthritis these days. So what are the symptoms and what is thumb arthritis?
Well, thumb arthritis, like arthritis anywhere in your body, is just wear and tear of the cartilage and joint space. And essentially, thumb arthritis is one of the more common forms we see. It affects something like 1 in 3 women, 1 in 8 men over their lifetime. A lot of times you start having just pain at the base of your thumb, difficulty pinching, grabbing things, opening bottles and jars. A lot of people will notice difficulty, the big concern is things like texting, things like that, just because...
No!
But no, just because that's the kind of position that may put a lot of stress at the base of your thumb. And you may just notice a lot of pain at the base of your thumb doing things like that, or, the classic things also, an older person doing crochet or needle pointing will have a lot of difficulty sort of pinching or grasping the needle.
So is it overuse of those activities? What's the most common cause of having some thumb arthritis?
Well, there's going to be some degree of overuse in the hand and the joint, but also there's going to be a bit of genetic predisposition. If you have horrible arthritis that runs in your family, you're going to be predisposed. And unfortunately, women are predisposed to this just because they tend to have a little bit more ligamentous laxity, which makes the joint more susceptible to damage.
800. All right, so we have the diagnosis, we have the problem, we've had some of the myths. Well, how do you treat it? What can you do?
Well, a lot of times people get better doing just using things like splints, watching their activity levels with certain things. Then medications can help out, things like Tylenol, ibuprofen, and other anti-inflammatories. And if you need to see me, we can do things like injections, or in some cases, when those all don't work, there are a lot of really good surgical options to help take care of this.
So you don't have to live with the pain.
You do not.
But Best of Health line, 1-800-454-9800, and they're going to push you in the right direction.
Like health, we get it.